My name is Mary Sommerlad. I am a consultant dermatologist, so that means I'm a doctor who sees people of all ages with skin problems. I decided to become a doctor, I guess, for a few reasons. One, medicine was in the family. So my dad was a doctor, my mum was a nurse. So I was always around people talking about health and disease. Um, so I was always kind of interested in that, and I liked science at school, and I loved the idea of doing a job where I was mainly helping people. And I think the other thing I love about medicine is the kind of detective work around it. So I liked that something could look one way or another way and how to tell the difference between the two. So I think that's it. So a bit of how I grew up and also just the way I like kind of solving a bit of a mystery. Also, I guess medicine's a lot about pattern recognition, and I find that quite interesting too. I chose to specialize in dermatology because I grew up with eczema. So I had terrible eczema as a child, and then it mainly went away, and then it came back. And when I was older, and it always comes back if I'm ill or stressed, or it came back when I was pregnant with my kids. So I know that huge impact that having a skin disease can have. It's not just the appearance of your skin, but it's also the way that you feel about yourself. So I used to hate looking in the mirror because I'd see the eczema on my face. It would keep me up at night scratching. I'd worry about what clothes I could wear because I could see the eczema on my skin. So that was one thing. And then I love recognizing patterns. I'm a very visual person, so dermatology just seemed to be the perfect mix. It's very pattern based, but you've also kind of got to solve the mystery because there could be 5 different things someone has a particular rash on their hands or their face. So I really like that bit. I'm also really passionate about skincare, I guess, because of growing up with a skin disease. You, from a very early age, get used to moisturizers and cleansers and how to look after your skin. So I kind of grew up being very aware of those things. So when I decided I wanted to be a doctor, although I wasn't completely convinced whether dermatology was the career for me, I definitely knew I wanted to do something that had a big impact on the quality of life for someone, where you were helping them in ways that had a big influence on their lives. And from, I guess, a personal point, it was something that I could also really relate to. I did a bachelor's degree. My intercalated bachelor's degree was in immunology, and a lot of immunology is involved in dermatology as well. So I find it quite stimulating from an academic side. And the other thing I love about dermatology is it's every age group. So right from newborn baby to children, teenagers, adults to the oldest person, anyone can have a problem with their skin. And there are also lots of treatments that we can do that can really help a skin condition. So I find it a very rewarding career. Really, really enjoy it. I think what my patients value the most about me is I love to listen to someone's problem and understand what it is that concerns them the most. So sometimes, especially in dermatology, somebody will walk in and I'll think, oh, I can really imagine what's causing the biggest distress with their skin problem. But actually, I always just want to listen. I'll always start with, tell me what's brought you in today. And actually, what I may think is the biggest problem, so maybe the appearance, is actually not what they think is the biggest problem, which may be the treatment they've been prescribed before, or maybe they want to very specifically understand the condition so they're not too worried about how it looks. So I think that's what they would value the most about me. I would also hope the management, I like to take someone as a whole, so really not just give the cream or the tablet, but also understand how it impacts their quality of life, whether the treatment I want to give them actually is pragmatic, so works for the lifestyle that they have, and making sure that they understand whether this is a chronic condition, so that's going to be something that they have to learn to manage, or whether it's something that I expect should improve with the right treatment. Do I have any mantras or catchphrases? I guess my most important mantra is listen to your patient. So listen to my patient, because if you listen, you will understand not just how their problem started, but also the treatments that they used, and also any concerns, expectations, frustrations they have. So often at the beginning of a consultation, I find if I just sit back and listen to the story from beginning to end with very few interruptions, I'm really able to understand my patient and also help them. And not just the skin problem, but also any of the issues going on around that skin problem. So things that might be triggering. So good examples for me are, I find that things like stress, lifestyle have a huge impact on skin, and that will come out in what they tell you if you let them listen. Whereas if I just shoot off lots of questions, I might not gauge whether they have stress with their job, their relationships, their family situations, and that might have a big impact on how they respond to treatment. So listen to my patients, probably my big mantra. I don't think I have any sayings, but I'll have a think for those.